Okay, so now we'll be doing an IV piggyback. So when we do the IV piggyback, we want to check our MAR to make sure that we have the right solution, the right medication that we'll be inserting into the solution. We will also be doing 6 patient rights, so the right patient, the right medication, the right time, the right dose, the right route, and then at the end we'll document it correctly. So we'll get our small medication bag. We'll get the type of medication we're using. We will wash our hands. So this says that we're going to be administering 2 mils of the medication. So I'll get my syringe and needle, and I'll pull back to 2 mils. I'll clean the top of my medication vial. I will insert the needle. I'll insert the air. I'll rotate, and I'll pull out 2 mils of our medication. Perfect. I'm going to recap the needle with the one-hand method and just have it sit like that. Now we'll open our tubing. We're going to be in the patient's room at this point, and we're going to make sure that we have the right patient. So we'll do name and date of birth. So we'll pull out our secondary tubing. They give you this, and you'll just take your IV fluids. You'll hang them on here. Hang this on there. So now with this, there'll be this cork. We'll take our med, insert the needle, and administer the medication in. Take out the needle, dispose of it in our sharps container. And you just want to make sure that the med is incorporated. We will place this above our normal saline. We'll take our second medication tubing. We'll make sure the clamp is off. Take it. Take the blue rubber stopper off. Pull this. That's about halfway. Calculate your right. So you're going to take your prep pad, clean both ends, insert your piggyback tubing. And just like before, you'll figure out your drop rate. So let's say we want 28 drops a minute, so you can do 7 drops in 15 seconds. You'll time it. Make sure all this You'll check your IV site, make sure everything's fine. You'll document everything that you need to, so the right medication, how much medication you put in, the drop rate of that medication, how long it's going to be infusing for. And come back in about every hour, sometimes less when you're administering a medication, and make sure everything's still